Indwelling urinary catheters promote urinary elimination, prevent or relieve bladder distension, and can be used to obtain a sterile urine specimen. To complete this exercise, you will need a mannequin in a hospital bed, linen hamper, indwelling catheter kit, urine collection bag, catheter leg band, chucks, clean gloves, extra sterile gloves, and a bath blanket.
Hi, my name is Gina Luciano. I'm an RN here in the Francis Payne Bolton School of Nursing, and this is Jackie Russick with me to demonstrate indwelling catheter insertion in a female patient. For the purposes of saving time, we've already wrapped the patient's legs so that we can keep the patient warm and comfortable and yet have a easy exposure to seeing the meatus. Before you get started, you might want to cleanse your patient so that they are all clean before you start this procedure. So what you would do is just take clean gloves and with warm water and washcloths and soap, you would wash your patient. You can discard your soiled linen in a soiled linen container and remove your clean gloves and discard them in the trash. At this point, you'd want to wash your hands again before you start your sterile procedure. It's easiest when you do an indwelling catheter or any sterile procedure if you have all your equipment nearby and set up. You want to have a trash can near you so you can discard all your soiled and dirty equipment. The patient is positioned so that you can see the meatus, but also positioned for comfort. You want to make sure that they're lying down with their legs spread apart so that you can easily visualize the meatus. Bring a couple extra pair of sterile gloves just in case you should contaminate anything or the patient moves. This is the Foley catheterization tray, and in this tray you should have everything that you need. Before you ever do a sterile procedure, it's a good idea to check to make sure listed in the kit is everything that you should need. You want to open your kit at the tear line and we'll discard your trash. It's easiest if you put the tray on the patient's bed between the patient's legs. That way you have everything exactly where you need it. In this tray, you want to open this away from the patient. Be careful when you open that you don't cross your sterile field. And your last one would then come towards the patient. You want to pull this as close to the patient as possible without contaminating. In the kit, the first thing you'll find are your sterile gloves. You can remove them from the kit and keep them above your waist so that you don't contaminate them. Anything below your waist would be considered contaminated. When you open your sterile gloves, open them away. These are and they are labeled right and left. Don your sterile gloves, remembering to keep your hands above your waist. Next, inside the kit, we have a drape that is two-sided. This is sterile, and it gives you an additional sterile field. The one side is shiny, and the other side is not shiny or dull, and you want to place the shiny side down. Be careful when you place the sterile field down that you are not touching any of the linens. You want to slide this under the patient without touching the patient. Next inside the kit is the fenestrated drape. This can be placed either side. It's the same on both sides. And you want to place this over the patient so that you can see the meatus. This drape is very important in a female because it helps you visualize the meatus, and it also gives you a place to place your hands without contaminating. So you drape this across the patient. This is a sterile field, this is a sterile field, and now this is all sterile. Inside this kit is a tray. The tray contains the water for inserting the balloon and inflating the balloon, and the povidone iodine strips. Also in this tray is the lubricant for the catheter. You want to lubricate your catheter so it slides into the meatus without resistance. Also in this tray is a label for labeling any specimens. In the other part of the tray is the Foley bag already connected to the 14 French catheter. 14 French is the usual size for a female adult woman. Female adult. What you're going to want to do before you insert this catheter is you're going to want to check your balloon. This valve here is for inflating the balloon, and the catheter is sterile until you remove this sterile sleeve. You take the syringe filled with sterile water, you remove the black cap, and you inflate the balloon. The balloon can hold 10 cc's. You want to inflate it to make sure the balloon inflates. Once you get your balloon inflated and there are no leaks, you deflate the balloon. And you keep your syringe attached for when you're going to insert the catheter. Next, you want to open up your lubricant at the tear here edge. You can pour the lubricant into your tray. It's best if you use all of it. And then you want to remove the protective sleeve holding onto your catheter and lubricate your catheter. You can then leave your catheter in the sterile tray lubricated. Make sure that you lubricate the catheter up to about 3 inches, because you're going to insert the catheter 3 inches into the meatus. Now you want to take your povidone iodine swabs, open the package at the tear here, and cleanse your patient. At this point, you want to use your non-dominant hand to cleanse the patient, to hold the patient open, and use your dominant hand to cleanse the patient. You want to spread open the meatus, and with a top to bottom motion, you want to go down the farther side away from you, discard your swab. You're going to go down the side closest to you, discard your swab. And then you want to go down, straight down the middle, discard your swab. Now, with your dominant hand, you want to pick up your catheter. Bring it close to the patient. Without touching the patient anywhere but straight into the meatus, you want to insert the catheter right in, 2 inches. At this point, you should see urine flowing. Once you see urine flowing, you want to insert the catheter another 2 inches. Hold the catheter, inflate the balloon. The reason we go a little further in is we want to make sure that we're past the sphincter and we're able to inflate the catheter balloon. And then with a twisting motion, you remove the syringe. At this point, you want to give a slight tug on the catheter to make sure that the balloon is inflated in the urethra. You want to now secure your catheter to your patient's leg so it's not putting traction on the patient's meatus. You want to place your urinary drainage bag below the level of the patient, attached to the bed frame and not to the side rails. And you can remove your drape by tearing it around the catheter. Okay, then you want to discard your equipment. Discard your gloves. Return your patient's legs down and cover your patient.